very good morning to Dr. Saleha and all my fellow friends. My name is Lim Jing Hui. We are from the Group 7. Today we want to present our assignment, which is the case study 3 for the STM 4201 nutrition therapy. Our group member have CHAN JING HUI, Ling Junho, No AISYAH BINTI HAMID, and NAJMA ASYIQIM BINTI MUHAIZI. Based on the case study 3, May is a 40-year-old Chinese woman. She is a single businesswoman. She diagnosed as a hypercholesterolemia. Her family history is her father has hypertension, type 2 diabetes, and stroke. Her weight is 66.4 kg. Her height is 158 cm. Her plasma glucose fasting blood glucose is 5.7 mmol per liter. Random blood glucose is 7.4 mmol per liter. Her serum lipid profile is triglyceride is 1.68 mmol per liter. Total cholesterol is 5.83 mmol per liter. HDL 1.5 mmol per liter. LDL 3.56 mmol per liter. Her blood pressure is 110 per 70 mmol per mercury. She also had take the red wine 3 until 4 times per week, and 1 time is around 1/3 of cup. She also have do the yoga 1 week 2 times, and 1 session is around 40 minutes. This is a table of our assignment content. We will share about 4 points, which is dietary factors could optimize a patient lipid profile. Next is nutrition care process, which is NCP. Thirdly is meal plan, healthy eating and cooking tips. And lastly is strategy for healthy eating out. The firstly is the dietary factors could optimize the lipid profile.
For the first one is by reducing saturated and trans fat, which is the source of saturated fat is found in red meat, full fat dairy product like cheese and butter, and the tropical oil just as coconut oil and palm oil. For the source of trans fat is found in partial hydrogenate of edible oil, which often used for processed food and fried foods that contain unsaturated fatty acid to saturated fats. It also can lead to the increasing of heart disease, stroke, and other cardiovascular issues. It plays a role in maintaining the heart health, reducing the risk of chronic disease, and promoting overall well-being. For the second is by increasing high fiber intake, which is the food from the fruits, vegetables, and whole cereal and legumes that contain antioxidants, just as vitamin A, C, and E. It also has a cholesterol-lowering effect and a good energy source that can balance the effect of lipid reduction. It will bind to the cholesterol in the digestive system by preventing the absorption and reducing the cholesterol level on the bloodstream. For the last one is by becoming more physically active, which is this diagnosis is associationally improved by aerobic exercise. Aerobic exercise is any form of physical activity that can produce an increased heart rate and respiratory volume to meet the oxygen requirement for activated muscle. The timing of physical activity at least 150 minutes or maximum 300 minutes per week, which is moderate, and it can optimize on the lipid profile in hypercholesteremia underlying of health condition. That's all from me.
Secondly, I will share about the nutrition K process, which is NCP. Based on the information, we can know that May is an overweight person. Her BMI is 26.6 kilo per meter square. And next is the biochemical data. The fasting blood sugar of May is 5.7 millimole per liter, which is slightly higher than normal, and random blood sugar, which is 7.4 millimole per liter, which is within the normal range. Nextly is serum lipid profile. Her triglyceride is 1.6 millimole per liter, which is within the normal range. The total cholesterol is 5.83 millimole per liter, which is slightly higher than normal, and HDL is 1.5 millimole per liter, which is slightly lower than normal, and the LDL is 3.56 millimole per liter, which is higher than normal range, and blood pressure is 110/70 millimole per mercury, which is within the normal range. Nextly is a clinical assessment. May is diagnosed as a hypercholesterolemia, and her family history is her father has hypertension, type 2 diabetes mellitus, and stroke. And next is a dietary assessment. She had intake the alcohol 3 to 4 times per week, and one time is 1/3 of the cup of the red wine, and she also have exercise. She have do the yoga 1 week, 2 times of the yoga, and one session about the 40 minutes. And next, she mostly eating out and eating irregular meal, and she also will do the 24-hour diet record. This is the 24-hour diet record, the table. We can know that May from the breakfast, she take the breakfast at 7 a.m. Usually she will take 2 slices of wholemeal bread, 1 tablespoon of peanut butter, and 1 glass of low-fat milk, which is the total calories, which is 153 of the bread, 98 calories from the peanut butter, and 110 from the low-fat milk. Next, her lunch is around 1 to 2 p.m. She will took the 1.5 cup of the white rice, which is 250 calories, 1 piece of the fried chicken, 1 piece of the vegetable stuffed tofu, and 1 glass of the plain water, which is 271 of the chicken, 992 from the tofu. Next, until 6:30 p.m., May will do her dinner, which is 1 plate of spaghetti bolognese, which around 364 calories, 3 pieces meatball, which around 171 calories, 1 small bowl of egg salad, which around 216 calories, and 1 glass of orange juice, which is 118 calories. Next, until 10 p.m., she will do the supper, which is 1 glass of egg, which allow 103 calories. So one day, her total calories is around 1,946 total calories. Next, I will pass the time to Jing Hui.
Okay, the next is I would like to introduce about the nutrition diagnosis. There are 3 types of nutrition diagnosis that the patient had faced. First is the excessive fat intake is related to food and nutrition related knowledge deficit as evidenced by the total cholesterol of more than 5.17 millimole per liter, LDL of more than 3.4 millimole per liter, and the patient's history is diagnosed as hypercholesterolemia. Second is the excessive energy intake is related to a lack of access to helpful food choice as evidenced by the estimated intake of energy is more than the estimated energy needs and BMI of 26.6. And the third is the excessive alcohol intake, which is related to food and nutrition related knowledge deficit as evidenced by fasting blood sugar of more than 5.6 millimole per liter, and the patient's diet history of alcohol intake 3 to 4 times per week. Next,
We can see the nutrition intervention. First, we discuss about the diagnosis 1, excessive fat intake. We will recommend the patients consume foods in high soluble fiber into their diet, such as oats, oat bran, legumes, barley, fruits, and so on, to reduce the uptake of cholesterol into the bloodstream. Besides, we also recommended the patients to decrease the total fat consumption to below 30% of overall energy intake, which this will restrict the saturated fat to less than 10% of total energy and keep trans fat intake under 1% of total energy. Because we can emphasize the importance of minimizing foods rich in saturated and trans fat, including items like red meat, full fat dairy items, processed foods, and margarines, and so on. Last, we also recommend the patient to consume some vitamin B, specifically pentatonic acid, vitamin B5, and niacin, vitamin B3, into their diet to help lower the triglyceride level and elevate the HDL, which is the good cholesterol. Besides, niacin is effective in improving lipid profiles, which can contribute to better cardiovascular health. And the pentatonic acid can obtain from avocados, yogurt, eggs, meat, and legumes. Next, we focus on the diagnosis 2, excessive energy intakes. We can regulate the portion size, which is essential to the patient, by mindful eating or the awareness of hunger and fullness cues, which can help to avoid the overindulging, limit the processed fruit and sugar-filled beverage, can help also to cut down the empty calories. Besides, do a consistent physical exercise will burn the excess calories and enhance general health, complementing dietary adjustment, because this will help to promote the weight control and speed up the body's metabolism. We also recommend the patient to prioritize the equilibrium of macronutrients, which like the carbohydrates, proteins, and lipids, which is essential. For example, whole grains, carbohydrate, lean meats, and good fats will help to maintain high energy level. Last, we focus on the diagnosis 3, excessive alcohol intake. We will advise the patient to consume the foods like high in omega-3 fatty acids, like some walnuts, flax seeds, and fatty fish, especially the EPA and DHA in the omega-3 fatty acid may mitigate some of the harmful effects of alcohol and promote the brain health. We also can provide the drinking goals for patients, aiming to restrict their alcohol intake to levels below the recommended guidelines. We also begin by reflecting on personal reasons for wanting to reduce or quit the alcohol consumption, and we can also establish a specific and achievable goals for alcohol reduction. This could include the limits on daily or weekly consumption or working towards complete abstinence, depending on individual circumstances. Last, we can learn about the health risks associated with excessive alcohol intake. This will make the patient to understand the impact on physical and mental health, can provide additional motivation to cut down or quit. Next, we can give some nutrition monitor and evaluation to the patient. So, like at the next appointment, the patient's weight status, plasma glucose, serum lipid profile, and diet history and ABCD will be reassessed to ascertain the patient's commitment to following advice. So, if the patient struggles to comply with previous suggestions, does not follow the recommended parameters, then Then the dietary will consult with them to find out the reasons and then come up with a fresh strategy for a fresh intervention.
For the meal plan to determine her daily energy requirement, a quick method was used by multiplying her weight 66.4 kilograms by 23 calories per kilogram, considering her moderate activity levels. This results in a daily energy requirement of 1,527.2 kilocalories. For protein, targeting 20% of the daily energy requirement, she should consume 305.44 kilocalories from protein. This corresponds to about 76.36 grams of protein, contributing to muscle maintenance. For carbohydrate, targeting for 55% of the daily energy requirement, her carbohydrate intake should be 839.96 kilocalories. This corresponds to about 210 grams of carbohydrates, providing a crucial energy. For fats, targeting for 25% of the daily energy requirement to fats result in an intake of 381.8 kilocalories. This corresponds to about 42.42 grams of fat, supporting various bodily functions. From the previous calculation for macronutrient requirement, we know that the carbohydrate required is 210 grams, protein is 76 grams, and 42 grams of fat. The meal plan for her includes 3 servings of vegetables, 2 servings of milk, providing 30 grams of carbohydrate, 16 grams of protein, and 2 grams of fat, with a total of 180 kilocalories. Additionally, there is 1 serving of meat or poultry, contributing 14 grams of protein and 8 grams of fat, totaling 130 kilocalories. 1.5 servings of fish are included, contributing 21 grams of protein and 2 grams of fat, with a total of 105 kilocalories. A legume serving in her meal provides 14 grams of carbohydrates, 14 grams of protein, and 0.5 grams of fat. Furthermore, 3 servings of cereal contribute 90 grams of carbohydrate, 12 grams of protein, and 3 grams of fat, with a total of 450 kilocalories. 3 servings of fruit contribute 45 grams of carbohydrate and 180 kilocalories. Finally, 5 servings of fat contribute 25 grams of fat and 225 kilocalories. From the food exchange system, the meal plan includes 205 grams of carbohydrates, constituting 55.03% of the total macronutrient. The protein content of 77 grams contributes to 20.67% of the total kilocalories. Meanwhile, the fat content of 41.5 grams represents 25.07% of the overall composition.
Based on the percentage of micronutrients just now, we have plan one of the table of menu planning for May, which is for the breakfast. May will took 1 serving of milk, 1 serving of cereal, 1 serving of fat. Until morning snack, she will took 1 serving of vegetables, 1 serving of fruit, 1 serving of fat. And next, which is until lunch, she will take 1 serving of vegetable, 1 serving of meat or poultry, 1 serving of cereals, 2 serving of fat. And the afternoon snack, which is 1 serving of vegetable, 1 serving of legumes, and 1 serving of fruit. Until the dinner, she will take 1.5 serving of fish, 1 serving of cereals, 1 serving and fruit, and 1 serving of fat. Until the snack, she will take 1 glass of the milk. Now we have shown that the breakfast, she will take 1 glass of low-fat milk, 2 pieces of wholemeal bread, and 1 tablespoon of reduced fat mayonnaise. Morning snack is, we suggest that 1 big slice of flour, 1 cup of raw leafy udon, and until the lunch, we suggest 1 cup of white rice, 1 piece of egg ikan tenggiri, half cup of fried kangkong. Until the afternoon snack, we suggest 1 cup of dry goji berry, 2 rectangular pieces of the tempeh, 1 big slice of watermelon. Until the dinner, we have suggest 1 cup of white rice, 2 pieces of lean beef, plus 1/3 cup of anchovy and 1 whole medium slice of apple. Until the supper, we have suggested 1 glass of raw fat milk for May. Besides that, May should be prioritize her healthy eating because this will be beneficial for her hypercholesterolemia. Firstly, she needs to prioritize a diet rich in the fruit, vegetable, whole grain, legumes, nuts, and seeds. And besides that, reduction in the intake of processed food also important, which especially for the high sodium, sugar, and harmful fat content. Moreover, she needs to maintain the ratio of fat, protein, and carbo in her meal. Furthermore, she needs to give the priority to unsaturated fats, which can be found in food like almond, avocado, and olive oil. And she also needs to limit the portion size because this can help prevent overeating in calories while encouraging weight management. For the cooking tips, May should be used the technique other than frying, such as steaming, grilling, baking, or roasting. Besides that, she needs to choose the heart-healthy cooking oil like coconut, avocado, or olive oil because this especially is the unsaturated fat, which will be beneficial for her health. Next is she needs to put an effort to incorporate fresh fruit, vegetable, and whole grain in her meal because this is to balance her meal, balance her food diet. And next, she needs instead of using the salt for the flavor, she needs to prioritize to use the herbs, spices, citrus juice, or vinegar to adding the flavor to her meal. And lastly, she needs to optional for the lean protein sources, including the tofu, bean, lettuce, fish, and the poultry because these have the higher protein content and these are good to her health. Next, I will pass to the AISYAH for sharing her part.
Next is strategies for healthy eating out. First strategy is prioritizing healthy fats. Healthy fats, those found in olive oil, avocados, and nuts, which is a crucial strategy for supporting cardiovascular health. These unsaturated fats, when consumed in moderation, have been associated with lower levels of LDL cholesterol, which is a key factor in reducing the risk of cardiovascular diseases. Next, another strategy is making mindful choices in carbohydrate selection. Carbohydrate selection plays a pivotal role in cardiovascular health for a patient lipids profile. Opting for complex carbohydrates such as whole grains and legumes instead of refined option contributes to the regulation of cholesterol levels. Next is elevating fiber intake. For example, oats, barley, beans, lentils, fruits, and vegetables. These nutrient-dense choices, abundant in essential vitamins and minerals, not only support heart well-being but also enhance digestive health. Next is striving for a balanced meal. A well-rounded approach involves incorporating lean protein, healthy fats, and complex carbohydrate into each meal. This combination not only helps in maintaining stable blood sugar levels, but also contributes to supporting overall heart well-being. Next is monitoring sodium intake. High sodium consumption is associated with an increased risk of elevated blood pressure and related cardiovascular issues. It underscores the importance of informed choices even in social or dining out settings, demonstrating a commitment to long-term cardiovascular wellness. Next strategy is maintaining proper hydration. Integral to overall health, influencing digestion and appetite regulation. Water, a vital component for bodily function, supports the efficient breakdown and absorption of nutrients during digestion, preventing overeating by addressing the often misinterpreted sensation of thirst as hunger. Next is navigating buffet choices demand. Buffet typically abundant array of high-calorie and high-fat options. Prioritizing nutrient-dense options ensure that the food consumed provide essential vitamins, minerals, and other beneficial compounds without excessive calories or unhealthy fats. Next is cultivating mindful eating practices, a holistic approach to fostering a positive and conscious relationship with food. Adopting a slower pace allows the body to register satiety more effectively, helping prevent overeating and promoting better digestion. Next is navigating special dietary needs, such as those associated with conditions like diabetes or gluten sensitivity, demands thoughtful consideration when selecting items from a menu. Individuals facing those dietary restrictions should prioritize menu choices that align with their health requirements. Next, another strategy is engaging in a leisurely walk after meal. It aids digestion by stimulating abdominal muscle and facilitating the movement of food through the digestive tract, reducing post-meal bloating or discomfort. Additionally, this simple physical activity plays a crucial role in regulating blood sugar levels, promoting better insulin sensitivity, especially vital for individuals with lipid profile problems. And lastly, the last strategy is regular monitoring through healthcare professionals. Monitoring allows healthcare professionals to assess the effectiveness of dietary and lifestyle interventions. Making adjustment to the diet is a vital aspect of lipid management, often involving modification to the types and amount of fats consumed. That's all from our group. Thank you.